we are back again here at BJVIM, and we are having a roundtable discussion. We're opening the discussion about the collaboration between you, legal volunteers, and now Bluffton Self-Help. So Ashley, can you share with us specifically a little bit about all of the facets of Bluffton Self-Help and how you all collaborate?
Sure. So our focus is really looking for our neighbors who are struggling and barely getting by, and that's who often comes to us for basic needs services. So how do we get a family to thriving? So we do that through food, clothing, and emergency financial assistance that covers utilities, rent, or mortgage. And often when we have those initial conversations and start peeling back the layers, we determine that income and employment is probably an issue. And the reason folks aren't earning a living wage is a lack of education. So on the other bookend, we have education programs. We have more than 350 adult learners, GED, English as a second language, citizenship, digital literacy, financial literacy. So again, as we're looking at this holistic picture, we do a couple things really, really well, but we rely on our partners to fill in the other pieces of the puzzle. If someone comes to us, we start having a conversation about financial assistance, but they need health care, or they've been evicted, and that's the reason we're having this conversation. We need our referral partners.
Do you all collaborate on what the most pressing issue is first? I mean, I would think that also is a real challenge. Here are the presenting problems. How do I prioritize?
So we've had that situation where we're talking to a woman specifically about she can't pay her electric bill. Why not? But she's sitting in the chair with our client advocate and she's so uncomfortable. She's in pain. So really the question was, okay, we're going to figure out the electric bill, but we got to get you to VIM because your health care is, primary right now. So sometimes we're referring out before we're even working in.
And so, again, you had talked a little bit before, there are navigators or advocates that actually help you all go through the process.
That's right. That's exactly right. And so they're trained to sort of have the key questions and sort of to know, because again, if they would just come to me, I would ask questions, but I might not ask the right ones. But someone that's trained as a navigator or a community health worker has the questions and knows how to get those answers.
And maybe this isn't the right question, but I'm going to throw it out there. From a collaborative point of view and a funding point of view, I know you talked about the Community Foundation. Let's talk a little bit about them just for a moment to see how they enter into this picture.
Absolutely. Yeah, I mean, they were super generous to us. We did apply as a collaborative to get some funding to hire our medical legal partnership attorney based on the Greenville model that's been so successful in the upstate. And they were more than happy to give us some funding for 1 year. We're currently seeking further funding to support that position because it's so vital. And she is our point person.
Okay. And that is who basically, with all
has
of
been
you.
helping us.
So do you find so far, and I know it's early on in the process, that people are starting with you and then you all are sort of the filtering system, for lack of a better word?
No, I don't think so. I think it's, again, who's ever gotten that patient or that client first, and then through their associates have been able to find out what some of the needs are and then referred them.
What has surprised you? Have needs emerged that you just really weren't?
I don't know why it's surprising.
That's
we in the last quarter of 23 saw such a huge increase in the number of folks coming to us for food, 30% increase in households needing food. And so one of my conversations with one of our funders, food is an indicator. Food insecurity is an indicator.
So that's Maslow's baseline.
Else is about to happen in 2024. And I think that, this is an art and a science, and how do you prepare? It's hard to write a budget and write a grant and kind of guess, but because I think we're all really good data collectors, we are able to make adjustments and kind of open our eyes to new opportunities. I mean, once Pam and I started talking, every new patient now at VIM, because we share this intake form, they're automatically getting signed up to shop in the market at Bluffton Self-Help.
Oh, they are?
Saves you $400 in groceries a month. So now that's impacted your financial ability. Put that $400 towards something else. And once we started getting in a groove, Ann and I started talking, 77% of the households we serve are women-led. Probably single, maybe with children. So we should start doing something around child support.
Exactly.
So that's, I think, our next conversation. How do we formalize something? So then it's just like layers
Well, it's almost like
Absolutely.
scaffolding. You set this foundation,
Yeah,
and now
right.
you're building on it.
Yes.
You didn't have to have all the answers.
Right.
Yes,
You
and
just had
as
to ask
Courtney
the
can tell
questions.
you, just having that child support that every child is frankly entitled to and
Right.
needs that support, and it can be court ordered. So mom can now stand a little more on her own 2 feet
Right.
and make some better choices for herself and for her kids.
That makes so much sense. We're going to take a quick break, and we're going to come back for our last segment to kind of tie all this together. Again, I think the more we talk, the more questions we have, the more exciting it becomes. Stay with us.